Our next speaker is Kayleigh Summers. Kayleigh is a licensed therapist, writer, and content expert in perinatal trauma. Kayleigh uses her training as a licensed therapist and her lived experience as an amniotic fluid embolism survivor to collaborate with hospitals and medical staff in facilitating the implementation of trauma-informed care, specifically for the pregnant and postpartum population. Kayleigh has also created thriving support communities as the Birth Trauma Mama through Instagram and TikTok, as well as her podcast, where she provides connection, story sharing, and resources to support those experiencing perinatal trauma. Her talk is titled Beyond the Delivery Room, Understanding and Managing Perinatal Trauma After OASI. Thanks, Kayleigh.
Hi everyone, I'm Kayleigh Summers, as I was just so wonderfully introduced by Amanda, and I'm here to talk a little bit about OASI and birth trauma, and I really want this to be a helpful space where you can feel validated and heard in your experience, because we know how much the impact of these injuries can have, not only physically, but also mentally and emotionally. And so I'm really excited to be able to have this conversation a little bit today. I want to start off with why am I here? Why am I talking about this? Why is this important? We know at this point that about 1 in 3 individuals leave their birth feeling traumatized. That is over 1 million individuals in the US each year that, again, are leaving their birth experience with trauma. And I believe that has probably only increased since the pandemic and the isolation that brought along. And we want to do something about it, right? We want to be able to prevent some of that, and we also want to be able to offer support and mitigation for those who do experience it. I'm going to give a quick definition because I think this is important for us to all understand just as we dive into some of the content today. So birth and perinatal trauma is any distressing event during or related to the perinatal period, so pregnancy, birth, and postpartum, that overwhelms the nervous system's ability to cope and causes ongoing distress. So again, it's subjective in nature, which means it's going to look different for everyone, depending on their experience, their perception, and their nervous system they walk into their experience with. And so we really can't compare trauma, which I will often talk about. So interventions and complications, we know from the research, can increase the risk of birth trauma. And there was a study done in 2023 that looked at the mental health after a perineal trauma, and it found that a direct association occurred between that perineal trauma, those lacerations, those injuries, and post-traumatic stress symptoms. And when we say PTS, it's just because PTSD, the actual diagnosis, has a length of time that's associated with it. So before we get into that length of time, we refer to it as post-traumatic stress symptoms. And so we see that increase again with that perineal trauma in the research. And it also found that the more physical symptoms a patient experiences related to their injury, the more likely they were to report symptoms of anxiety and depression. This all makes sense. You all have probably experienced this if you've had these injuries, but I think it's so validating to also see it play out in the research. Like, you are not crazy. This is happening, and there is such an intricate connection between physical symptoms and the experience of these types of injuries and your mental and emotional well-being. And so we have to be taking care of both of those things when we are looking at healing, and we have to pay attention to both of those things when we are looking at healing. As I kind of mentioned around the subjectivity of trauma, trauma is a nervous system event. It is not a choice, and it is not a failure. It is a neurobiological response that you don't really have a say in. A patient feeling traumatized by their birth is not a choice or a decision that they have made. When trauma occurs, parts of our nervous system get activated and take over as a reflexive response, an automatic response. So this is where we see those typical sort of responses like fight, flight, freeze, fawn. Those are used to protect us in that moment. But because of that, it actually interrupts our nervous system and our brain's typical way of processing memories. And so when we process a trauma, it is not integrated in the same way that typical memories are, and it is not tagged with the same information. And what I mean by tagged with the same information is it doesn't get this stamp from the hippocampus, the memory center of the brain, that says this happened in the past. So every time it gets activated, it feels to your nervous system like it's happening right now. And the best way that I can describe this is through a study that was done back in 2023. And it looked at those who had been diagnosed with PTSD. And it had them record themselves saying a happy or neutral memory, a sad memory, and a traumatic memory. And then it played it back to them while they imaged their brain. And what they found was that for the neutral, happy, and sad memories, that hippocampus that I mentioned, that kind of memory center for simplicity's sake, was activated, was lit up. That's what we would expect. That makes sense. We're listening to memories, we're going back in the past, we're recognizing them. That part of the brain is going to be lit up. However, when they played back the traumatic memories, that part of the brain was not activated. The hippocampus was not activated. And instead, something called the posterior cingulate cortex, which is related to like internal processing and daydreaming, was activated. And what that tells us is that trauma doesn't act like a memory in our nervous system. It acts like a present experience. And we are no longer just assuming that or theorizing that. We are seeing that on brain imaging. We are seeing that happen right before us. And so I really want you to take that with you, that the trauma that you've experienced, when something happens to trigger or activate it, that overwhelm is because your nervous system thinks that experience is happening again to you. It doesn't have an end to it. The other part of why this is important and why we care is because of the long-lasting impacts. And specifically, we're going to talk a little bit more about this in the later part here, but specifically around isolation and shame with these injuries, we see how these can create so many impacts on things like sense of self. I already talked about mental health, but medical anxiety, relationships, parenting, being able to like get out of the house. So many people are tied to their house because they constantly need to use the bathroom. They constantly need to be able to clean themselves. That negatively impacts your entire life and your relationships and the dynamic of the family. So these traumas don't just end on the day that they occur. I call them kind of like ink blots that slowly but definitively bleed on every part of your story. And that is why, again, we see these completely change our lives when they occur. So I want to talk specifically, I've talked broadly about birth trauma, but I want to talk specifically about what it means to have an injury and live with that injury of an OASI and have a constant trigger. Because for a lot of people who have injuries after birth trauma, not only do they have the re-experiencing of the trauma itself, and I want to kind of clarify a little bit here too, because when I've worked with clients in the past who have had these injuries and our community members who have had these injuries, sometimes the trauma isn't necessarily like during the birth experience. It absolutely can be. But a lot of times we see other moments of trauma when you get the diagnosis, or the diagnosis is totally missed, which unfortunately happens more often than not. And you go home and you have an experience of passing fecal matter through your vagina, and that is completely traumatizing. And that can be, again, and there could be like multiple islands, I call them, of trauma. And so it's not always just the birth experience itself, and I think that's important for us to remember. But then we have these constant triggers that you're living with. every time you go to the bathroom, I know this again from people I've worked with, can be activating and can be triggering. And so now we're trying to help you cope and heal with a constant trigger that's happening throughout your everyday life. That is so hard, and I really want to validate that for all of you who have experienced it. Let alone if you have a baby that survived their birth, you are not only taking care of yourself, but you're also taking care of your baby. And there is this really difficult piece of this where you are taking care of a baby who needs to have constant diapering and constant making sure that they're okay and constantly changing and cleaning. And then you also have to be doing that for yourself because of these injuries in a lot of cases. And that can be so devastating because you expected to be doing that for your baby, but you never expected that you would also have to do that for yourself. And so there's a lot of shame and isolation that comes with injuries like these. And I love that we have supports like the SOLACE Foundation because we're talking about this more and we're taking it out of the darkness of like the deep dark corners where we don't talk about it. And we're talking about it because we should be, because people are suffering from these injuries and they deserve to not feel alone. And they deserve to know that they did not cause this and this was not their fault. So getting support through the community, of course, like I just mentioned, the SOLACE Foundation, they have great support groups. Connecting with other people who have had similar injuries, I think is also really helpful. Therapy, of course. I will recommend both individual and couples because I think a lot of times partners don't fully understand the experience and the impact, and it can be hard without kind of a third party there to really help them understand your feelings and your experience of this event and this ongoing medical event. And trauma-informed pelvic floor PT. I'm a big fan of pelvic floor PT, obviously when it is appropriate in your medical journey, but making sure you find someone who understands these injuries and is also trauma-informed in their approach. This is, of course, not an exhaustive list, but just kind of a place to start. I want to also just mention a couple of pieces here related to those who are treating patients who have had these injuries or truly any perinatal or birth trauma. But in the research, we see common frustrations cited by patients with, again, severe perineal lacerations are a lack of information and a dismissal of concerns. Those are the two top things that are the biggest frustration. We need to have more conversation and information, and we also need to be able to not only validate concerns, but offer supports and solutions for those concerns. And this really lines up with our community in general. So I did a post where I asked people what they wish their medical team had done or said after their birth trauma. And I had more than 550 responses from birth trauma survivors. And the top two things that they wished that they had received were acknowledgement and debrief. And far and away, acknowledgement was mentioned in every single comment. Simply acknowledging the experience that they have had, simply acknowledging the injury that they have had, and then debriefing them about it. So every patient, in my opinion, should have a debrief, but particularly patients who have had unexpected or difficult births or outcomes or injuries, they need to understand what has happened to them. They need to understand why, if we have some of that answer to the why, we don't always, but they deserve that. We have people leaving the hospital having no idea what happened to them. We have people leaving the hospital who have had lacerations that need to know that certain things can happen. There can be breakdown. There can be experiences that they need to look out for and get care for immediately. And that is not something that we are informing patients about, and we need to be. They need to be leaving the hospital feeling prepared and educated on what happened to them. I already talked about acknowledgement, but a simple recognition of what a patient has been through. And then I like to talk about repair for medical providers and healthcare workers because we screw it up sometimes. I'm going to show you like what to say and what not to say, what to avoid, what to say in these situations. And you might screw this up, and that is okay because you are human, but we can always go back and repair. We can always go back and say, hey, I didn't love the way I approached that. I'd like to kind of restart if that's okay with you. I'd like to say that in a different way because I don't feel like it really landed well. But it takes humility, and it takes kind of like leaving our ego at the door to be able to repair with patience. But it changes outcomes. It quite literally changes lives. So just not going to read through all of this, but just keeping this up here as some common things we'd like to avoid saying to most patients, and patients specifically who have experienced an injury like this. Again, some more helpful supports specific to this kind of complication or injury, the SOLACE Foundation, obviously. And then for looking for that individual and couples therapy that I had mentioned before, Postpartum Support International has a free directory that you can look through. You can put in your state, your insurance, what you're looking for, and everyone in that directory is has some sort of training in perinatal mental health. They also have a ton of free groups on that website as well, and a helpline. So you can always call the helpline to help get connected with a therapist in your area. And then, of course, again, specific complication support. I know there are lots of different kinds of support groups out there on Facebook that can connect you with others who have had similar experiences to you. That was a very quick rundown of all of the things, but I hope there were some helpful nuggets in there for you, whether you are a patient or a medical provider or someone who works in the birth space. I just want you to know that your care that you provide matters. And as patients, your story matters, and you matter, and your experience matters. So thank you so much for being here. And again, I hope it was helpful. Happy to answer questions that you have.
Thank you, Kayleigh. That was so helpful. I really think a lot of folks that tuned into the summit and follow SOLACE are going to feel really validated, even just seeing some of those statistics from kind of newer studies even. I saw one from 2021. So there isn't a lot of research in the US necessarily focused on these birth injuries. So that was really validating even for me to see as somebody who looks for new information in this space. So I'm hoping that some folks see those numbers and feel like, oh, okay, this happened to me and I'm not crazy, or I'm not being dramatic, or I'm not just overreacting about something that happened that I'm feeling really challenged about.
Yeah, exactly. And if anyone wants to see the research articles, they are all at the bottom of the slides. Anytime I mention them, they have the information at the bottom of the site, at the bottom of the slide.
Thank you. I think one of the first and easiest questions that I wanted to throw out there for our listeners is, when looking for a trauma-informed therapist, if they're feeling ready to heal, or they're just like tired of feeling the way they're feeling and they want to start this challenging journey of healing with a therapist, what would a title look like, or what kind of credentials should we look for to find a therapist who's trauma-informed?
Yeah, that's a great question. So I think that if you are attempting to find someone who can help you reprocess or integrate your trauma, I would recommend someone who is trained in some kind of bottom-up approach, is kind of how we refer to it. So I believe, as a trauma therapist, that we can't talk our way out of trauma. I think talk therapy is wonderful, and I'm constantly doing talk therapy, and I think it is supportive. And I also think that it cannot be the only modality when it comes to trauma. We need something like EMDR, like internal family systems, like brain spotting, like somatic experiencing, anything that is more body-based and that kind of bottom-up approach, as opposed to that more cognitive, talk-based or cognitive behavioral type therapy. So I would say look for that. But then the other thing that I would really, really recommend is making sure that you get a free, like 10 or 15-minute initial consult call. Every therapist should offer that. If they don't, I always say then they're probably not the therapist for you. You should get to test out, at least get the vibes in the first 10 to 15 minutes for if that professional feels like a good fit for you without having to pay a bunch of money up front. And in that conversation, I have like a whole podcast on like what you should ask, but the one thing I will just say here is I would focus that 10 to 15 minutes on asking the therapist about their approaches, about how they worked with someone with this kind of injury before, have they worked with someone with birth trauma before, how do they approach birth trauma, rather than sharing your own story. That is very important, but you will have a whole intake session to do that. And it's probably better to use that time to just learn more about the therapist and their approach to see if it's a good fit.
That's really good advice. I know it can be daunting to share about injuries like this and experience, but I do think it can be discouraging when you just dive in with the therapist and you feel almost like obligated to keep that relationship going, even if it's not serving you. So that's really good advice, I think. Thank you.
Of course.
Um, Similar question. What would be maybe the best advice we could give someone who feels traumatized in taking the first step? Or when might somebody know they're ready to like dive into these conversations and this journey? And everybody's different, obviously, but what might be a sign that someone's in a place where they should pursue this journey of healing with a professional?
Yeah, I mean, yeah, it's going to be different for everyone. But if you are noticing that you have symptoms that are interrupting um, your daily functioning, interrupting big parts of your life, you just feel uncomfortable and you want to be able to feel less of the symptoms that you're experiencing, that's a great time to look into it. Another point that I do want to make too is someone, again, who is a trauma-informed therapist who's trained in trauma knows that you don't have to talk about your trauma to be able to heal it. So if you're doing something like EMDR, you don't have to tell someone the whole story of your trauma in order to do EMDR, brain spotting, other types of somatic therapies. So if your fear is like, oh, I don't want to have to sit there and recount the whole story, you do not have to. And even if you wind up with a therapist who asks you that, you just say, no, thank you. I'm not in a space to do that right now. That's okay. So I don't want people to feel like until I can fully talk about my story, I can't go to therapy, because that's not true. You can absolutely go to
Okay.
therapy and you can absolutely heal even without telling your whole story and kind of re-traumatizing yourself. People may want to share their whole story and it feels good to them. That is totally fine. But I just want people to know it's not a prerequisite for healing and doing therapy.
One other question, and I think this one might resonate with a lot of folks. I see it often in our support groups or in some of these online spaces. And even I'm sure you see it a lot in comments on your posts, but there's obviously a lot of protectiveness about birth experiences. I think this is one of those monumental life experiences that we go through. And so folks feel very protective of their experience and their perception of it. Maybe those who didn't want a C-section and end up having one feel really disappointed by it and they feel traumatized. Others like us who suffer a severe laceration wish we had a C-section, and so we feel traumatized. How can we maybe remove some of the defensiveness that we feel about each other's experience to just open up a more supportive dialogue in this space when we're trying to, like, we're all trying to find connection and support, right? But we do feel that tension sometimes between differing experiences. I wish I had a C-section. You wish you didn't. I wish we could swap. How can we kind of remove that defensiveness and protectiveness from each other?
Such a great question. And we do see this a lot. I call it trauma soup. Like we're all just like swimming in trauma. Um, and the very honest and transparent answer is that when we first experience trauma, um, it's very hard to hold space for other people's experiences that are different than ours. And that's okay. Like that is valid. That is how trauma works. And so it does actually take healing and time to be able to get to a point where we can say, I wish I had had a C-section, but I totally understand why that isn't something that you would have wanted, or that is something that you experienced and it traumatized you. It's actually very difficult to access that when you're still in like the deep throes of your trauma. So I want to validate that for people and help them understand that that defensiveness comes from a place of activation. And I think we can also like help people recognize that. And not in a condescending way, not in like a deal with your trauma, but like not that way. But in a like, yeah, it's really hard to hold both of these things at the same time. We see the same thing with like home birth and hospital birth, and how those two things, people get very divisive about choices around that. We have to remember that our choices and our experiences are fully based on our own trauma and our own life experiences up until that point. And just as if you think about if you are someone who feels so strongly that you wish you had had a C-section, imagine again the people who had that same exact feeling of trauma, but for the opposite, right? So they feel just as traumatized and as strongly as you feel, but about a completely different experience. And again, it's really hard to get our brain to do that when we are like deep in our trauma still. So we have to do a lot of our own healing before we can like hold space for all of these, not just different experiences, but experiences that really kind of fly in the face or like clash with our experience. Not a very clear answer, but nothing usually is when it comes to trauma.
No, I think that's really helpful. Just to remember, I think that that's validating, right? Even just to say you maybe can't hold space for someone else's experience until you work through your own. So that's also very helpful. And I think even just reminding everyone that journeys take different amounts of time, even just healing from this kind of severe laceration. Some folks are maybe able to heal a little bit faster. They have less complications with their severe tears, and others are on a much longer journey to healing physically, emotionally, spiritually, all of that. So I think that's really helpful to hear and say out loud, right? Because sometimes I think we can get stuck in that trauma and think something's wrong with us, and there's nothing wrong with us.
No,
Um,
and like you get also get to be angry that someone else had an experience that would have maybe like saved you from your trauma. Like we get to be angry, we get to be jealous, we get to be all of those things. The difference is, of course, like finding an outlet for that that is not telling that person, right? That is not coming into that group and being like, well, I wish I would have had this experience even though it traumatized you. It's having the insight to be like, yeah, I'm so angry after reading that story because I wish that was for me, and I'm going to go tell my friend or fellow survivor who understands that and gets that my anger is about me and not about me wishing ill on someone else or being mad at that person. It's just our own,
yeah.
we're allowed to have those feelings.
Yeah, I think that's important to share. Thank you for saying that because like you said in your slides, there's a lot of shame that comes with this, not just from physical symptoms and being embarrassed because of stigma related to those symptoms, but also like mentally and emotionally. We feel like we're supposed to be happy and supportive, and sometimes we're just angry.
Yeah,
And that's okay for
it is.
some time.
Totally. It is totally okay.
Well, thank you so much for sharing this. I'm really excited to get it out to our summit folks. I think the biggest message from what you shared is that, it's okay to feel traumatized and it happens. And it's very validating to see those numbers and the truth behind this experience of trauma as a neurological process and not just being emotional. So thank you very much for bringing your expertise to the table and sharing and for being here today.
Yeah, of course. Absolutely.
Thanks.